Hi, thanks for joining us live today. If you're
Hello.
watching and you have any questions as we go along, we would love this to be interactive. Or if you're catching the replay and you have questions and you want to add them after the fact, we'll go back and try to answer them all for you. Because our heartbeat behind this live session today is to introduce ourselves to you. Because I think we said last time, people don't care how much you know unless they know how much you care. So we just wanted to share a little bit about our stories and why we do what we do in hopes that you will feel like, hey, if you are looking for help with your health and you've just been really disenchanted with the options that are available to you, like you feel like you're just a number in the big cog in the wheel of big medicine in healthcare, that there are options and alternatives. And sitting between us, I'm Dr. Jenny St. Ange. I'm a certified functional medicine doctor, and this is Tara Peterson.
Yep.
Introduce yourself a little bit.
Absolutely. So I have about 20 years of service in the medical field. I started in conventional medicine. I think I've shared that a couple times here on this site, that I just was standing in the midst of the crazy of the conventional world and was finding that patients weren't getting the answers that they were looking for. They were not really truly healing from their root causes. They were just kind of handing out band-aids. And although I love my medical community that I worked with, my coworkers, and understand that there's a need maybe for acute care, like if you had
Of course,
a broken arm, or if you had a real emergency setting, absolutely. But as far as chronic health, was not getting a lot of answers. And so actually, Dr. G, my personal story is I had a lot of IBS symptoms. And so I had a lot of bloating and just discomfort. I was in so much pain. I decided, what can I do to make this different? And so I did a lot of research in functional medicine and using nutrition for my health. And I found that if I took gluten out and if I had a low carb diet, that I felt so much better. I was like, wow, there's something into this. I've got to learn everything I can. And so that's kind of where I saw a transition in how I wanted to treat myself, and then also how I wanted to provide care to the people that I came across.
Absolutely. So Tara, she's sitting here with 20 years of experience. I am at about the 20-year mark also in experience. I graduated from chiropractic school in 2005, so 18 years ago. And I started practicing this kind of healthcare before the term functional medicine even was a thing. It was just, people called it alternative medicine.
Like, before your country, you were a country. Before you were a functional medicine.
Yeah. There's a song, like, I was country before country.
Cool.
When country wasn't cool. I was functional medicine before it was even a thing. And fast forward, I took a little side detour and I went to work in a hospital setting. And I spent about 9 years in a hospital setting in the neurological world. I was in spinal surgery, neurosurgery, those kinds of things. And I just kept seeing, like, the hospital is one of the least healthy places on the planet for patients and the staff. Like, these doctors' lounges are full of Snickers bars and Cokes and smoke breaks and all this stuff. And it was like, whoa, that is not,
doesn't seem normal.
Yeah, it just didn't jive with my thought process. And I thought I've got to go back into practice and be an alternative and an option for somebody who doesn't want this. So that's when the term functional medicine at that point was a thing. There was organized schooling, education programs around that. So I went through, my training is through Functional Medicine University. So we've been talking about this for the last couple of weeks, like, what is functional medicine? How does somebody get trained in it? So you can go back and watch those lives from the past 2 weeks, or read the blog or the podcast or whatever. But that's where I came from. And then so for the past 6 or so years, I've been practicing this way. And I practice alongside my husband here in the office. He's with us. He's a chiropractor, and he does all the traditional, what you think of as chiropractic care, and something called an acoustic acoustic wave treatments, which are fabulous for chronic pain.
He's working on me right now. It's working out really well.
Yeah, he's worked on me too, and he works on himself and our daughter, and a lot of people. I had someone cry leaving the office yesterday because it was the first time that they haven't been in pain in years. So anyway, it's really good stuff. But so that's, and then you put him in the mix, and we've got like 65, 70 years, because he was a massage therapist for about 10 years before chiropractic school. So we have a lot of experience here in this office with natural solutions for healthcare. One of the other things we wanted to talk about is why we left. We both had lucrative jobs in healthcare, and they gave us a good steady paycheck, and we did our thing. And why would we leave that? You tell me why you did that.
Sure. Yeah. I mean, it could certainly feel a little scary to think, how am I going to do this out on my own or anything like that?
Yeah,
but
of course.
For me, it was just an easy decision because I knew that I had to find that solution, and I had found that solution for myself for my healthcare. So I'm thinking, okay, if this is working, and in such a different way, I'm not having to use any kind of medication, and so I can't not share it. I mean, I was just like so overjoyed. It's like when you have that information, you have to share it. And so for me, it was I wouldn't say it was easy in the aspect of letting go of past identities or past experiences, but it was easy in just wanting to move forward in a way that I felt was convicting for myself.
Yeah. And, I just left because it didn't jive. They were starting to do things in working in a hospital setting that I wasn't okay with. Forcing some shots, we'll just call it, and things like that I was like.
And this was before more recent accounts.
Yeah, this was 9 years ago or so when I left the hospital. But even back then, I was just like, this isn't congruent with what I believe. I believe in medical freedom. I believe in the power of the body to heal the body. I couldn't be authentic with myself and continue to work in that environment. And I just saw what healthcare had done to my mother-in-law and to my dad. They both were just so sick for the last decade of their life, and I believe it's from surgeries that maybe could have been avoided, and from drugs that they could have done something differently many years ago.
I'm sorry to experience that.
I had the most lovely couple in my office today, and I was reviewing his lab results with him after he finished a care plan, and they were just so confused because some of the things that we're doing run very counter to what they have been told in the conventional world. And so I'm kind of explaining to them, like, here's why I'm doing what I'm doing. Here's why I suggest that. And the woman said to me, she said, not everybody has a Dr. Jenny, and we're just so thankful that we have some other alternatives. And that just made my heart, that's why I do what I do. It is because if there's one person out there that is in the same situation as my mother-in-law or my dad, or, everybody is somebody's daughter or sister or mother or son or whatever. So, everybody has a story, and they deserve some options if they don't feel like they're getting what they're looking for in the medical model that is so abundant in this country.
You're so good at that.
Thank you.
Oh, absolutely.
And I think we've touched on this a little bit, why we both chose to go down this road, because we're both very personally invested in this type of healthcare. We do these things, all the things that we recommend, we do them.
Yeah.
In the office, we do them together a lot.
Yeah.
We like to run together and stuff like that. So
we make the whole office do jumping jacks.
We do, because we're like, oh, we've been sitting too much. In fact, we were just talking about, as soon as we get done sitting here doing this, we're gonna go walk laps around and outside in the parking lot because it's sunny and we need to move and we don't want to sit too long. So and then we're both just really, this is a passion. This is more than just a paycheck for me, honestly. Like,
Absolutely.
a lot of times this type of healthcare is harder to practice because you're outside of what is typical. So, health insurance doesn't cover what we do. So that makes us just have to be so much better for
Sure.
someone to say, oh my gosh, I could go get healthcare inside of the insurance model and they'll pay for it, but it's not solving my problem. We see that a lot. And that breaks my heart that someone is paying $1,000 a month to use healthcare and they're not even getting, they don't even get value out of it. They just have it in case the catastrophic thing happens, which I understand. And I think there's wisdom in having that safety net in place. But,
Not really
yeah,
healing,
it
not really
breaks my
living
heart.
life
But
to the fullest.
having said that, when people are paying their money out of pocket, they
invest in it.
Yes,
The results.
they're invested in it, and I think that's some of the reason why we get good results because people want to be here. They're invested in the process, and actually, if you sit down and itemize how much things cost in the healthcare system, we're a bargain. Sometimes people have a hard time seeing that because it's coming out of their pocket, but in terms of really what you get for the time and energy.
I think one of the things that patients will express that they appreciate is just the amount of time that we spend. We invest into them on their
100%.
case, but then also the amount of time we spend in front of them. And so, if the average doctor visits 7 minutes, that we've learned through our patients,
Yeah.
we spend, Dr. Janine spends at least an hour on that first lab review and really taking the time to make sure that patients understand what their root causes are.
Yeah, I want people to feel heard. I want them to have a chance to ask questions. I want to, in 7 minutes, can you even ask somebody what they had for breakfast and have a good conversation about that? I can't even do that, let alone review 75 lab markers. It's just not going to happen. So, anything else you wanted to say?
This has been fun to share our story and to learn. I learned a lot about you last week, and hopefully, when people are watching, they can ask us any other questions that they have. Maybe they thought of when they're listening to us today.
Yeah, and we have a link in the comments for something called a discovery call. If you are like, you know what, I need to talk to you guys about what this looks like, having labs done, sitting down with Tara, mapping out foods to eat, all that kind of stuff. We both take those discovery calls, so just get on the schedule and we'll talk you through that and see if we can help you. Thanks for watching.